back, everyone. It is us. We are Be Defray
in the house.
And today we have an amazingly special guest. We have Dr. Traci Kimball, who's a resident wound doctor here, she's a doctor, but she's a wound expert specifically here in Denver, Colorado.
That's a lot.
That is a lot.
Thank you. Yeah.
So how would you like to call us? Dr. Traci? Traci, how would you like to be referred to?
Well, one thing you couldn't say that would be kind of cool for branding would be Dr. Traci, otherwise known by her patients as the Wound Wizard.
The Wound Wizard. Okay, I like that.
It's a magic because it is official. We are on the trademark registry.
Oh.
So
okay,
that's cool.
What exactly?
They can search that on Google or Instagram, and it's my page.
Got it. I was just going to say, educate me because I'm not entirely up to speed.
No, you're not. Well,
help us, Dr. Traci.
Well,
help us.
No, I actually just so I could just distinguish myself as a expert in wounds. One of my patients gave it to me many years ago, and I just went ahead and branded it. Okay. Submitted to the patent office as a trademark.
Huh.
Did you know that you could trademark yourself?
I can't use that because that's not good.
You can't do that?
It's trademark.
But you can. So, quick question for you, though, Dr. Traci. So, that's so really cool that you're very specialized in the wounds and all that. So, what got you into this before we start asking some further questions? So, what appealed you to, hey, let me focus on this because this is something that is helpful or whatever. So, help us understand that a little bit.
Well, I'm just a general surgeon by training. So, just a general surgeon. But by training, I did general surgery. And as surgeons, we create wounds. And wounds our patients are typically all ages. I typically deal with an older population now, but in training they were of all ages, even from children to sage age adults. And so I was introduced to wounds through surgical training.
Gotcha.
And then realized that wounds can be developed, or just in general we call it skin injury, can develop from trauma on the skin, from burns on the skin, from chemicals on the skin, from infections on the skin, from surgeons that bring a knife to the skin.
Yeah.
And depending on the patient's ability to heal or the skin to repair, a wound may become chronic and become almost symbiotic, living with the patient. And so specialists are introduced to the care plan of the patient to actually help that patient get to a full, whole, closed position and heal their skin. Because anytime the skin is broken, there's a risk of infection and a risk to potentially life.
Yeah.
So real quick, just to spit this out there, give us a real quick synopsis as to how, as a wound expert, you would take care of mending those scars.
So the first step is to understand the reason why they have a wound. Many times it's surgery. I bumped my leg on the side of the wheelchair in my patient population. I fell and scraped my knee, or I went rock climbing and I scraped my elbow, or I burned myself because I dropped hot water, or I decided to smoke with my oxygen on and singed my nose hairs, or worse. Yeah. So the first step is to understand the reason. And once we understand the reason, we also need to understand the patient's medical problems. So we get a good thorough history of their medical problems, because many medical problems like diabetes or malnutrition, even obesity can all delay the wound healing process. So once we get those answered, then we proceed to determine what are the other barriers of healing. And some of the big ones are infection. Sometimes it's pain. They just cannot tolerate the cleaning of the wound. So we have to treat that sometimes. And once we understand the full assessment of the wound and the state it's in and how old it is, and then we can start to one by one attack those different barriers and attempt to reverse them and encourage the body to activate its own healing mechanisms to then heal.
Okay. Wow. So not like your typical, I got a scratch and put some Neosporin on it for us.
Yeah.
People who are
Well, I mean,
Not aware.
yeah.
the complexity of chronic wound healing is significant. And so a scratch on your skin or a paper cut, where you put some Neosporin on it, those are typically really straightforward, and they're called acute wounds. And so we do these first responder measures,
Right.
and most of them will get better. But in a cadre of patients that have, like I said, all those different issues in health, then even a small little paper cut can turn into a massive infection.
Yeah.
On, say, if it was in a diabetic patient. So even small breaks in the skin in diabetics can lead to infection and then additional skin injury from the infection, which leads them with a larger gaping,
My goodness.
penetrating ulcer is what we call that.
Okay.
This is like all brand new to me. I didn't think it was so specific to the person. Of course, I mean, I feel like just give Tylenol and everything's going to be good.
Yeah.
But it's very different because
It
depending
is.
on your diet and your genetics and all the craziness that we all have within
And
us.
even now, learning like age,
Mm-hmm.
it wasn't something I thought about before. That
Yeah.
Based on your age, how quickly or slowly you will heal. So that's interesting.
Right, and actually the healing process also is determined by what we call social determinants of patients. So social determinants of health, their living status, their
Wow.
their
Whether
skin
they're happy or
color.
not. What?
Their skin color.
The
Believe it or
skin
not,
actually.
skin color determines patients' abilities to get better or to even have appropriate care diagnosed.
Okay, we need to.
Now I got questions. I know
love
all
it.
the questions. But go ahead. Go ahead.
So, how exactly?
I'm going to tell you exactly how.
Help us. Oh my gosh. What?
Okay. So believe it or not, high melanin content skin color. So individuals
Like myself.
like both of you, there's a disparity in the ability to diagnose infection and inflammation because just visually the inability to see the color change as easily. And so, for example, one of our more severe types of wounds we treat, which is called pressure injury, subtle skin changes in color. We call it blanching. So the ability for pink to go to white, it's really hard to see.
Gotcha.
So yes, skin color does determine somebody's ability to figure out if a wound or skin is at risk, and then the ability to diagnose certain problems within that wound once it's occurred
Wow.
about infection.
Interesting.
So the cool thing about it is this industry is now developing tools that augment our ability to diagnose with the visual eye by using imaging and cameras to help determine if infection is present or poor circulation, because poor circulation is another factor in wounds that we can sometimes determine with just the naked eye. But in high melanin contents, it's harder to see
Oh my goodness.
that difference.
Interesting. So it's good to be high melanin,
But also,
but it's also bad.
it's also,
to be
yeah.
Depending on what your medical problem is.
Got
Yes.
it.
Dang.
Exactly.
Okay.
So I see that you have a product here with you. Why don't you tell us a little bit about this product?
So my company, Wish Skin Labs, is developing our first product called Emerald Wound Care. And it's a moisture associated, or it's a cream that is going to be, or is developed for skin injury or skin breakdown due to moisture. It's a skin repair cream. So it's made with ingredients, earth-based ingredients. This is a little bit different than some of our more common things.
Okay.
Earth-based ingredients, all natural. We have dimethicone, which is from a silica-based mineral, but it's still earth-based. So, but a constellation of ingredients from zinc to dimethicone to hemp seed oil to lanolin. So we're going to bring this to market in the next few months and start selling for patients that are dealing with moisture, rash and moisture in areas where moisture is
Okay.
highest concentration, I guess,
Got it.
or found.
So then does it aid with pulling out or drying out moisture, or?
Right. So the skin has to have a balance in humidity or water content. And so in areas where there's a lot of extra moisture because of either incontinence or sweat, then the skin it will absorb that moisture and then become at risk for skin breakdown. And if the moisture that's introduced from the environment has a different pH than the skin, it can change the skin's pH and then cause almost chemical burn on the skin. And so the cream in and of itself is a moisture barrier cream that will provide additional layer of barrier protection for ongoing injury. And then also because of the botanicals inside of the product, essential oils and terpenes from plants. Terpenes are chemicals that are beneficial medicinally that we know about. Then it will help to soothe itching, soothe pain, soothe inflammation, and help with the healing of the tissue.
Gotcha. Are there like any known, as of right now, side effects once you put it on? Like how long? What's the frequency of use?
So, good questions. We are recommending that it be used twice a day. It can be used in a preventive way. So if you know that your loved one's skin is at risk because, say, they're a bedbound patient or they don't have the ability to get up on their own to go and go to the bathroom, and they wear, like a Depends or an adult diaper, then we would say use this twice a day in a preventive way, so before skin injury strikes. In a primary treatment mechanism, though, you can also use this for the same frequency once the skin breaks down to then also help with the additional benefit of soothing and supporting the skin repair. And once the skin repairs itself, then you continue to just use the product in that preventive kind of way.
Gotcha. So I should not just be using this as a lotion all day, every day, just because my skin is dry.
No, that'll be the next product in about 2 or 3 iterations.
Okay, please. I would like to be the first tester because I'm ashy right now. So
our hope
help
is
a
to...
brother out.
Right.
Our last video was talking about moisture or the lack thereof here in Colorado.
In Colorado,
Yeah.
yes.
On the skin, specifically.
Right. Well, and different climates are interesting in terms of wounds or at-risk skin. More humid tropical climates, the risk of infection is higher because bacteria like to breed in humid climates.
Of course, yeah.
And so Colorado, we have sort of the added benefit of being a drier climate with the risk and the incidence of wound infection. So I deal more with trying to rehydrate.
You guys heard that? Move to Colorado.
It's helpful for
Not
everything.
in drones.
Yeah.
We can't really facilitate.
I'm not sure if our population will be able to accept that, but so most of my job really is to balance moisture in a wound to help it heal, because it's essentially a very natural. I want to say it. It's like a test tube or a culture dish of cells, and if we let that dry out and leave it open to the air, then those cells die and they don't function and they don't replicate and they don't heal. So a lot of times I'm actually adding moisture to wounds when patients are being seen in my clinic. Yeah. But in this regard, for this particular product, it's the moisture that's being introduced externally to areas that don't tolerate that, and then it causes the skin to break down.
Gotcha.
And so we need to then protect that with this layer of zinc dimethicone.
Okay.
Wow.
So when this is available, where can we get a hold of that?
So our plan for distribution channels is going to be e-commerce, and we have a site we're building at wishkinlabs.com. It's our Shopify site, and you'd be able to order it. We are currently providing a pre-sale order campaign through Indiegogo, and that's at igg.me/@/WINNV. And that's our Indiegogo pre-order sale, where we have some really amazing branded merchandise for our clients and our patrons to buy. And with that, they're going to be able to pre-order their first sample of product.
Wow.
Gotcha.
Okay. And if you guys didn't get that, we'll
provide the link later.
Eventually.
But I would love to see it, smell it, look at it. Is that possible?
Yes,
Can I
it's
do this?
totally. So it is. It's green, and that's from the botanicals that we have placed inside of it. So our botanicals are essential organic chamomile, lavender, tea tree.
Yeah, I can smell the lavender.
And the one that you can probably really smell that's a really forward aroma is oregano.
Oh, I was like, I'm smelling something that I typically eat. But yeah, so this is cool.
So I like to say it has sort of a natural cut grass, like a natural cut.
It's super earthy in
I
odor.
like it. Yeah.
Yeah. And
I
then
was like, do I have a cut? That means do I have a wound?
That's
I'm
so
just
wild.
gonna put it on.
Smelling the oregano and the lavender at once. It's like the right side of my brain is like, woo, we're super happy. And
Yeah.
the left side's like, let's break this down. Let's tear this apart and then pull everything out of it. That's
right.
really
So
interesting.
and it's funny because I didn't, when I first got into formulation, and of course I have this amazing formulation team of scientists helping with this, but I never realized that it's almost like being a perfumist or a coffee bean selector. I don't know the fancy word for that, but there's these forward scents that you get a sommelier in coffee.
For the coffee.
But essentially that's what it is. It's like it's like oregano forward, mid tones in the tea tree world, and then it finishes with lavender.
Love it. Yeah.
I think the beautiful thing about it though,
Did you put some on your finger?
And it's not oily.
So, I mean, this wouldn't be something would be easily demonstrated because the more common sites that this would be applied to is a very discreet, derriere area.
Mm-hmm.
All right.
But you can use it for things like athlete's foot, any rashes or chafing that you might just, if you're an athlete and you do a lot of running, get chafing in areas.
Wow.
So
you do a lot of running, right? Bhavani?
Yeah, I run a lot.
Just kidding, but this.
That's my goal for 2023. Running.
And so and the plan,
I like this, and it smells really good. Like, because a lot of times when you think of applying some of these products, the smell typically is what takes me away. Yeah. But so this would
doesn't have a strong medicinal. Medicinal smell. I mean, we definitely wanted it to be pleasant. Mm-hmm. And I also wanted it to, not rub in completely, because, and it's quite interesting to see how it functions on your hand, but, you probably didn't put a whole lot on there. I didn't put a lot, yeah. But, we always ask we always instruct our clients to put a layer thick enough that you can still see it. Because that just reinforces that it's being used.
Mm-hmm. Got it.
Because for the most part, I mean, these are areas, that our clients, a lot of our clients end up being in are bed bound. They're patients, and they have other ongoing medical problems. And this is it's non-prescriptive, over-the-counter product, but it's usually managed under the supervision of a provider.
Right.
So since we call it a proscription or the doctor's order, if you put on a product that rubs in too easily, then sometimes you wouldn't be able to tell that it was even being used.
Right.
So it's an adjudication process that we actually can see that it's being applied.
Gotcha.
For that loved one's skin.
I love that.
So, and it does a little bit, it's there's some transfer, but we typically say, leave it uncovered. And because dressings really don't stick to this because of the oils that are in it. So,
that's cool.
Yeah.
That is amazing.
Thank you.
Wow.
You're welcome. And the cool thing is the company itself is studying hemp-derived botanicals. So the plan is to eventually iterate this particular product to also combine with hemp-derived CBD and CBD cannabinoid derivatives. But this particular first iteration is going to be without the cannabis.
Okay.
Got it.
Yeah.
Sounds like we may need to have you again for a second episode with more details, and I would like to try this as well too, because I know I cut myself all the time doing some dangerous things, because I live dangerously.
Living dangerously on the dance floor.
I do cut myself sometimes.
All right. Okay? Well, that's all the time we have for you guys today. Dr. Traci, thank you so much for being here and being our honored guest.
Thank you.
to start out this year. With that said, we will see you all on our next episode.
Deuces. Yeah. Love you.
So there's when it's recording and he switches cameras, there's a red dot.
Can't run from myself. There's nowhere to hide. Don't make me close one more time.
Let's get it.
Hey everybody, welcome back. We are. Wait, you want us looking this way?
You're looking out there. You're looking at the red light. He just explained it. Red means go. Actually,
Red means
It's the first recording jitters.
I love it. It's awesome.
Oh,
this is.
God.
I mean, we're here.
I'm giving blooper.
I mean,
blooper moments.
Okay, that's
We're giving blooper moments.
Not intentionally, but it's there now.
It's cool.